There are numerous causes of erectile dysfunction. The primary ones are either psychogenic ED, so the signals aren't getting sent from the brain down to the penis properly. That can be things like anxiety, depression, also hormone problems like low testosterone, certain medications, or other hormone issues like low thyroid disease. Then there's neurogenic ED, which is where the nerves aren't getting sent from the spinal cord out to the penis properly. That's usually patients either with poorly controlled diabetes or with spinal cord injuries. And then finally, the vast majority of patients have what's called vasculogenic ED. That's where not enough blood is getting into the penis, or blood gets in, but it leaks back out. You can't maintain it there. All of the issues that would cause vascular problems elsewhere in the body are also risk factors for vascular ED. So that is heart disease, high blood pressure, high cholesterol, smoking is a major factor. All of those increase the risk of getting erectile dysfunction. So you should see a urologist to treat erectile dysfunction, because that's something we do every day, and it's because we have the full gamut of options available to you. We're not restricted to just the pills or just the Shockwave or anything like that. We're able to talk to you about all of the options, and we're able to manage them at every level. Low testosterone can contribute to erectile dysfunction. It's usually not the primary driver of erectile dysfunction. Mild to moderate ED is sometimes helped with testosterone, but usually testosterone symptoms are more low energy, a lack of interest in sex, lack of muscle tone or losing muscle tone, usually not as much erectile dysfunction. There are essentially 4 treatment options for erectile dysfunction that actually work. So there are the pills, Viagra, Cialis. They work great for people with mild to moderate ED. As the disease progresses, they frequently stop working well for people. In those cases, there are injections. So there's a medicine you can inject into the penis every time you want to have sex. It's a little bit stronger than the pills, but you do have to inject yourself in the penis every time you want to have sex. There is a vacuum device, so it's a device that you put around the penis to draw blood in, and then you put a ring at the base of the penis to maintain it there. And then there's the penile implant. So penile implant is a device that goes inside the body that gives you an erection whenever you want. There are a couple of other treatments that you may find on the internet. The primarily ones that people see are Shockwave, which is where they use high-intensity shockwaves to the penis to try to stimulate blood flow. The evidence for that is pretty mixed. It does work in some cases, particularly mild erectile dysfunction. The Sexual Medicine Society of North America doesn't routinely recommend it. There's also platelet-rich plasma injections, which has a lot of role in orthopedics for stimulating blood flow. It's not as clear that there's good evidence for stimulating blood flow in erectile dysfunction. The penile implant is a 3-piece device that goes inside the body. It is a pump that goes in the scrotum. It is a balloon that goes up in the belly, and it is 2 cylinders that go inside the penis. Whenever you want to have sex, you pump the pump, and it gives you an erection. The erection lasts as long as you want. Whenever you're done, you press a button on the pump, squeeze the penis, the erection goes away. The penile implant has the highest patient satisfaction of any of our ED treatments. It is 90% plus patient satisfaction, a 90% plus partner satisfaction. It is something that works reliably every time that you want to have sex. The penile implant is concealed entirely inside the body. It's placed through an opening on the scrotum typically, or just above the penis. And once that is completely healed, it is invisible to the naked eye. You can feel it within the scrotum, but no one from across a locker room would ever know there was anything else going on. There are, broadly speaking, 2 types of penile implants. There is the 3-piece device, where there's a pump that goes in the scrotum, 2 cylinders that go in the penis, and a balloon that goes up in the belly. There's also what's called a malleable penile prosthesis. This is 2 cylinders that go inside the penis that have a flexible coil on the inside, so that when you want to have sex, you can point it up and use it. When you don't want to have sex, you bend it down. The penile implant is placed during a surgical procedure. It requires a general anesthetic. It takes approximately 45 minutes. It is a same-day surgery. People come in, we do the surgery, you go home later the same day. It is about a 2 to 4 week recovery. People are having sex again between 4 and 6 weeks after surgery. There is a small risk of infection associated with the penile implant, about a 1 in 100 chance. If there is an infection, we have to take the penile implant out, wash the wound and then put a new device in. And about 80-85% of the time, we're able to rescue that implant. It's a mechanical device, and so they typically last between 10 and 15 years, and then they need to be replaced. It's not any harder to put the new one in than it was to put the first one in. We have been doing penile implants for over 50 years. The current generation of inflatable penile prostheses have well over 10 and 20-year data. These are devices that are well established and work well.